Hello. In this video, I have a lot of practice test questions and answers for A&P. Just let me know how you all did. If you all could just comment under the video, please like, share, and subscribe. Okay, for this section, we are going to talk about anatomical positions and planes. I like to read the questions, the answer choices, and then I'll give you a little bit of time to think about the answer, and then I'll give you the answer. So please leave a comment. Just let me know how many you got right, how many you got wrong, if you found the questions helpful, and if you found them challenging. Okay, question 1. A vertical plane that divides the body into right and left portions are called A. Axial plane, B. Coronal plane, C. Oblique plane, or D. Sagittal plane. Okay, the correct answer is D. Sagittal plane. Question 2. A diagonal plane that cuts through the body at an angle is called A. Axial plane, B. Coronal plane, C. Oblique plane, or D. Sagittal plane. Okay, the correct answer is C. Oblique plane. An oblique plane passes between the axes of two other planes in a diagonal angle. And if I'm going too fast with the questions, you can pause the video or rewind it if you need more time to think. Question 3. A horizontal plane that divides the body into superior and inferior portions is called A. Axial plane, B. Coronal plane, C. Oblique plane, or D. Sagittal plane. All right, the correct answer is A. Axial plane. So an axial plane is a horizontal plane that divides the body into superior and inferior portions. It is also called transverse plane, so just keep that in mind. Question 4. A vertical plane that divides the body into anterior and posterior portions are called A. Axial plane, B. Coronal plane, C. Oblique plane, or D. Sagittal plane. Okay, the correct answer is B. Coronal plane. All right, so I finished that section. Now in this section, we'll talk about directional terms. Question 5. If something is considered superior, this means that the person or object is located. I'll give you a few seconds to think about the answer, and then I'll give you the answer. Okay, the correct answer is above. So if something is considered superior, this means that the person or object is located above. Question 6. If something is considered inferior, this means that the person or object is located. Okay, the correct answer is below. So if someone or an object is considered inferior, This means that the person or object is located below. Question 6. Another word for front or anterior is called. Okay, I'm about to give you the answer, but I want to just point out if you notice two questions number 6, that's because somehow the questions got mislabeled, and I noticed this whenever it was time for me to edit and put my voice on the video, and I just did too many questions afterwards, so it was just too late to go back and change. So just disregard two questions number 6. But the correct answer is ventral. So another word for front or anterior is called ventral. Question 7. Another word for posterior is called. The correct answer is dorsal. So another word for posterior is called dorsal. Question 8. Which direction is used to describe towards the mid-sagittal plane? Okay, the correct answer is medial. Question 9. Which direction is used to describe away from the mid-sagittal plane? Okay, the correct answer is lateral. Question 10. Which directional term means toward the head? All right, the correct answer is cranial or cephalic. So that means towards the head. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Question 11. Which directional term means toward the feet? Okay, the correct answer is caudal. So caudal means towards the feet. Question 12. Which directional term means on the same side? All right, the correct answer is ipsilateral. Question 13. Which directional term means on the opposite side? Okay, the correct answer is contralateral. Question 14. Which directional term means the front or palm of the hand? Okay, the correct answer is palmar. Question 15. Which directional term means the sole of the feet? All right, the correct answer is plantar. You may also have heard of plantar fasciitis. This is an inflammation on the bottom portion of your feet. Can you please let me know in the comment box if you've heard of this term, or if you know someone or condition, or if you know someone who has had it before? I've had it before on my right feet, and I'm telling you, it does not feel well. It normally, well, now it doesn't, but when I did have it, it normally would hit me like in the middle of the night for whatever reason when I had to get up. But what I did was until the pain like went away, I had to take like pain medication, just something over the counter. And then I changed my shoes. My doctor recommended I change my shoes, and she also recommended that I lost some weight. So that helped. I just changed my shoes, lost some weight, and it went away. So I didn't have to like, she just diagnosed me with it or whatever. Thankfully, I didn't have to get any x-rays or anything. She just went by the symptoms that I gave her, the signs and the symptoms. So just put it in the comment box if you knew of this condition, if you know someone who has had it before. Um, yeah, but it's kind of painful to have. All right, so please leave a comment below and let me know what your major is. So what are you studying for in college? Whenever I went to school, I work in radiology, so I have like different departments in radiology I work in. If you're not familiar with radiology, we take x-rays, CT scans, ultrasounds, mammograms, like things like that. So whenever I was enrolling in school for x-ray, I had to take A&P, which is Anatomy and Physiology. I had to take A&P 1 and A&P 2. So if you can just drop a comment, let me know what your major is. Are you in nursing? Are you in phlebotomy? Are you in X-ray? So what major are you in for you to be studying the Anatomy and Physiology video? All right, thank you. Now we'll talk about quadrants and organs. Question 16. Which organ is found in the right upper quadrant? You'll probably see it be called RUQ. So RUQ stands for right upper quadrant. Is it A, liver, B, spleen, C, stomach, or D, tail of the pancreas? Okay, the correct answer is A, liver. Question 17. Which organ is found in the left upper quadrant, or LUQ? A, appendix, B, gallbladder, C, liver, or D, stomach? All right, the correct answer is D, stomach. Question 18. Which organ is found in the right lower quadrant, or RLQ? Is it A, appendix, B, gallbladder, C, spleen, or D, stomach? Okay, the correct answer is A, appendix. Question 19. Which organ is found in the left lower quadrant, or LLQ? A, appendix, B, gallbladder, C, most of the small intestine, or D, stomach? Okay, the correct answer is C, most of the small intestine. So the appendix is found in the right lower quadrant, the gallbladder is found in the right upper quadrant, and the stomach is found in the left upper quadrant. All right, so now we are going to talk about the bones. I work in radiology, so I do have to know all the bones that is in the body. So here we go. Question 20. How many bones is in the human body? A, 200, B, 202, C, 204, or D, 206? All right, the correct answer is D, 206. Question 21. How many cranial bones are there in the human body? A, 4, B, 6, C, 8, or D, 12? Okay, the correct answer is C, 8. Question 22. How many facial bones are there in the human body? A, 10, B, 12, C, 14, or D, 16? Okay, the correct answer is C, 14. Question 23. How many corporal bones are there in the human body? A, 4, B, 6, C, 8, or D, 12? Okay, the correct answer is C, 8. So there are 8 corporal bones that are found in the wrist. So that's where the corporal bones are located in. These bones are called the trapezoid, trapezium, capitate, scaphoid, lunate, triquetrum, pisiform, and hamate bone. So if you see the arrow pointing to the radius, that's not that's like part of your forearm and the ulnar. So that's why I told you which bones are the carpal bones. All right, question 24. How many tarsal bones are found in the foot? A, 3, B, 5, C, 7, or D, 9? Okay, the correct answer is C, 7. So the tarsal bones that are found in the foot is called the talus, calcaneus, navicular, cuboid, medial cuneiform, intermediate cuneiform, and lateral cuneiform. Question 25. Which bone is for hearing or sound? A, ethmoid bone, B, maxillary bone, C, sphenoid bone, or D, temporal bone? Okay, the correct answer is temporal bone. All right, so now we are going to talk about the organs in the body. Let me know how you all are doing. If you want me to make a part 2 to the video, just give the video a thumbs up or leave a comment so that I can know, because as you all probably know, or if you don't know, there's a lot that you have to know for your A&P class. so I can make another video just breaking down more of the things that you need to know as well. Question 26. Which organ is the largest in the body? A, brain, B, liver, C, skin, or D, stomach? Okay, the correct answer is C, skin. Question 27. Which organ is the second largest in the body? A, brain, B, liver, C, skin, or D, stomach? Okay, the correct answer is B, liver. Question 28. How many chambers does the heart have? A, 1, B, 2, C, 3, or D, 4? All right, the correct answer is D, 4. The chambers of the heart is the right atrium, right ventricle, left atrium, and left ventricle. Question 29. Which organ stores and releases bile? A, appendix, B, liver, C, gallbladder, or D, stomach? All right, the correct answer is C, gallbladder. So the gallbladder does store and release bile, which is a fluid that is produced by the liver. It helps to aid in digestion of fats. Question 30. Which organ produces hormones such as insulin and glucagon to regulate blood sugar levels? Is it A, liver, B, pancreas, C, spleen, or D, stomach? All right, the correct answer is B, pancreas. All right, so now we are going to talk about anatomical positions. I believe this is the last section. Question 31. What is the name of this anatomical position? All right, the correct answer is Fowler's position. Question 32. What is the name of this anatomical position? All right, the correct answer is supine position. Question 33. What is the name of this anatomical position? All right, the correct answer is prone position. Question 34. What is the name of this anatomical position? All right, the correct answer is right lateral recumbent. Question 35. What is the name of this anatomical position? The correct answer is Trendelenburg position. Question 36. What is the name of this anatomical position? The correct answer is left lateral recumbent position. Question 37. What is the name of this anatomical position? All right, the correct answer is lithotomy position. So in this position can be used for vaginal deliveries, your pelvic examinations, like your pap smears, bladder stone removal, rectal surgeries, laparoscopic surgeries such as removal of a fibroid or fibroids, and more. So these are just a few examples that I threw out. All right, this is the end of the video. Thank you all for watching. Please give the video a thumbs up or leave a comment if you found the video to be helpful. If you noticed that my face or picture was kind of flipping on certain slides, just tune that out, please. For some reason, this morning I was getting like a lot of text messages and I was like waiting on someone to text me about something. So I had to check my phone to see if it was someone that I really was waiting on a text message for something. But anyway, so when I do have to stop and then come back to the video, sometimes this editing software that I use, it kind of flips my video. So sorry about that, but if you want to, could you please leave a comment if you found the video to be helpful, and good luck in your A&P class whenever you do take it. So thank you all for watching again, and I hope to see you all in the next video or in the comment section. Bye.